Newstetter, and I'm the University of Chicago Health Lab Executive Director and the Transform 911 Principal Investigator. It's my honor and delight to serve as today's moderator and to introduce you all to what we have in store. Transform 911 is a group of experts consisting of over 100 people from all across the nation, including 911 professionals, academics, community advocates, government agencies, public safety leaders, people impacted by the criminal justice system, and technology specialists, to name just a few. The effort has been led by 16 co-chairs, many of whom are here with us today. We have benefited tremendously from partnerships and support with the Microsoft Justice Reform Initiative and the Wagner Foundation, who both have representatives in the audience here with us today, as well as Arnold Ventures and the Suzosi Foundation. Transform 911 envisions a system that equitably and reliably increases access to well-being for those who need emergency assistance, the professionals who staff 911, and those deployed to respond. We build on innovations in the field to address the challenges and the inequalities that are within our reach and control, recognizing that the change we envision cannot happen without shifts in the systems and the communities that 911 is to serve. Today, you will hear from many people about the opportunities and the challenges that have surfaced through this work. Importantly, much of our process has involved uncovering and spotlighting the great work of others, sharing it with boundary spanners who are well positioned to make critical connections, and developing pragmatic alliances across industries. The group developed 50 recommendations that were released through a public forum last spring for input and feedback. We were overwhelmed by the positive and instructive feedback we received. Equally valuable, however, were comments from individuals and associations that had shared with us how we had missed the mark, and whose suggestions ultimately strengthened this work. Together, we have curated all of the feedback and are releasing today a plan to transform 911. This plan includes the following recommendations, each of which are further operationalized into action steps and supplemented with examples in the Transform 911 Blueprint, which went live and released this morning on transform911.org. Congratulations, team. This plan includes the following recommendations, each of which are further operationalized. The first, reintroducing 911. Because while virtually everyone in the United States knows the number to call 911, virtually no one knows how the system actually works. Number two, putting the people into 911. Harnessing community partnership is essential to a 911 system that works for everyone. Advancing the workforce. As you'll hear in greater detail today, the 911 workforce is hurting. Some of this is the result of contemporary (911) are often conflated. This has been a heavy burden for the 911 professionals to carry. Many of these challenges, however, are longer standing. Since the inception of 911 professionals in the 20th century, the federal government has classified them as administrative assistants and secretaries. This is an issue that must be rectified, and we need to act together today to make sure it happens. Particularly as this workforce around 911 continues to grow, all first responders must be recognized as such. Number four, making 911 independent and equal. Transform 911 believes that 911 centers, or emergency communication centers, public safety answering points, as they're also known, achieve better outcomes and reduce the default on the reliance of police. This is essential because we know that only about a quarter of 911 calls for service nationally involve a crime in progress and involve the kinds of incidents that police are well trained and equipped to respond. We need to strengthen data and tech standards. The rapidly changing data and technology landscape requires that we instill reliable and ethical standards to apply to 911. And finally, securing national support for 911. Effective, equitable emergency response requires unequivocal support nationally. It's important to note that we are not calling for the federalized 911 system. We seek instead to increase federal investment and commitment to achieve a better understanding on the 911 landscape through improved data collection and integration, as well as minimum national standards for call taking and dispatching practices. You will hear more about the recommendations from our experts, and we invite you to please review them online at transform911.org. But first, it's my honor to introduce the Dean of the University of Chicago Harris School of Public Policy, Katherine Baicker, who has been instrumental in supporting this work, particularly in rooting the recommendations around public health, for which she is a nationally recognized expert. Dean Baicker is a leading scholar in the economic analysis of healthcare policy. Among other roles, she serves on the Congressional Budget Office's panel of health advisors. She previously served as a Senate-confirmed member of the President's Council of Economic Advisors, where she played a leading role in the development of health policy. Dean Baicker, thank you for joining us today. And Dean Baicker is virtual.
Hello, everyone. I'm excited to be here with you virtually, although I wish that I could be there with you in person. I'm so grateful to Rebecca, to the Health Lab team, and to all of you who participated in developing this vital set of recommendations. We rely on the 911 system. There are more than 240 million calls placed to 911 every year, and we need those resources available in the worst circumstances in our lives. There are dedicated professionals who work 24 hours a day, 365 days a year to try to make that help available. And if that system isn't well resourced and working well, we are all the worse off. But most of the calls, as you just heard, don't necessarily need police or fire to respond immediately. In fact, they're not the right resources, and they could be better deployed elsewhere. Many of the calls that come into 911 are about mental health issues, substance abuse, homelessness, calls for panhandling or intoxication, things that require those trained in mental health and other resources beyond police responses. And if we could have a system that allowed the right people to be dispatched at the right time, that would ease so many of the strains on the hardworking people in the system and result in much better outcomes for so many of the calls that are received. And of course, the shortcomings in the services that we're able to provide under the current system are a source of exacerbating inequities in the system. The harms of what we're doing now fall disproportionately on marginalized communities. So it's vitally important that we adopt many of the recommendations of this blueprint to improve services for everyone, and particularly for those populations that are the least well served now. This is a public health issue, and thinking about public safety and public health going hand in hand will allow us to transform the use of resources. This is something this group has been working very hard on. I'm thrilled to see these recommendations and very excited for today's programming to help explore them in more detail. I know the recommendations are so much better because of the engagement of all of you and all of the people who have commented on them. And this is a community effort that needs to be launched to make sure that we have the resources available to help people in their most vulnerable moments. And I know that everyone shares that goal. And I'm so grateful for all of the work that has gone into this. I am also incredibly grateful to be able to introduce Mayor LaToya Cantrell, New Orleans mayor, who has been working for years, both in her role as mayor and as a former city council member, to address the needs of her community. She's the first woman elected mayor of New Orleans. She's focused efforts over the years in helping her community, Broadmoor, recover from Hurricane Katrina, and help guiding her city, New Orleans, through the COVID-19 pandemic. She has been a staunch advocate for public health and public safety going hand in hand. I am so delighted that she can be here and very much looking forward to her remarks. I'm happy to hand over the microphone to Mayor Cantrell.
Thank you so much. Good morning. Dean Baicker, thank you so much for your leadership and just for your commitment over a long period of time. Thank you all for being here. My sister Mayor is so excited to be with you, and representatives, as you know, from all over the globe, whether it is New Mexico, Georgia, Florida, Arizona, and of course here in Louisiana. I'm joined also on the stage by my director, Tyrell Morris, who is the director of the Orleans Parish Communications District, which manages 911 and even 311 for the city of New Orleans. Now, Director Morris, along with Chief Kasmar, have been working relentlessly over 18 months, kind of leading and shepherding our work that has gone into what we are celebrating really here this morning in terms of the recommendations. We all know that re-envisioning the country's 911 system, that time is now. And let me tell you something, we've struggled with just the inadequacy. Oftentimes when this happens, it's your residents who feel like they're the only ones who have a system that's inadequate. But you being here in the city of New Orleans, let me tell you, you are aligned with what we've been saying all along. Changes need to be made. We're working diligently on them, not just in a vacuum or in a silo. We're working with communities and leaders across the United States of America, and you are an example of that being right here in our city this morning. So give yourselves a round of applause. And I'm clapping right here with you because my local media outlets are here as well. And listen, it's not a joke, it's not a show, it's real work that your team and in a collective environment have been doing, rolling up our sleeves, and I thank you. And even as the Dean talked about alternative response, again, it's something that we're lifting up here in the city of New Orleans. Now, while we have our plans in place, we have been waiting for our second allocation of the ARP dollars, which we have now received. And so as this is a priority for the city of New Orleans, again, you're allowing me to demonstrate to our local community, to the state of Louisiana, and to the country that the city of New Orleans continues to be moving in the right direction relative to alternative response. We know that it cannot all be put on the backs of our police officers. So much is carried on their shoulders, but this is the time to reinvent ourselves, reinvigorate how we serve the people of our cities. And I'm so happy that you're in the city of New Orleans. I'm going to ask very briefly for my director, Tyrell Morris, who's here to say a few words and just indulge us for a little minute.
Good morning, everyone, and thank you, Madam Mayor. I would be remiss if I did not talk about the only reason why New Orleans, the public safety team, has the ability to be innovative in our approach is because of your leadership, Mayor. The nation is watching us, and we are going to take that those eyes and steward and be good examples for the rest of the nation to follow. I will say, I do want to take a moment to recognize the other public safety leadership that are here with us in the city of New Orleans. I do see our Chief Deputy Superintendent, Chris Goodley from the New Orleans Police Department, as well as our Chief of EMS, Chief Bill Samaron. So in 2016, while the mayor was a member of the New Orleans City Council, she put forth the legislation to consolidate 911 in the city of New Orleans. At one point, OPCD and the 911 operations was the black eye of this city, where we saw 6-minute hold times on 911. And the mayor, along with the administration at the time, said enough is enough. And we consolidated and really put a system in place that met the needs of our city. So now we celebrate answering calls quickly. Our team has grown to 182 heroes at OPCD. And our mission is very simple: to get the right people to the right place at the right time, better than anyone else in the world. And right now we're laser focused on who are the right people. Sometimes it's police, sometimes it's fire, sometimes it's EMS, but we need to be much more open that maybe it's somebody else. 911 professionals across the nation, as I call them, they are the conductors of the well-oiled public safety machine. Each public safety agency that responds is a section of instruments, but when we don't conduct them right, they sound a hot mess, right? And we've seen time and time again where 911 system inadequacies has led to a bad song being played, but in the city of New Orleans, we do this very well. We welcome and protect over 18 million visitors a year, host 450 festivals annually, some of the largest events the world has ever seen or will ever see. And we do that with such pride, with a smile on our face, and with a spirit of service and leadership. So thank you all for your attendance today. Chief Kasmar, we definitely had, when he called in the middle of the night, he said, I need you to join this. I said, I'm gonna get beat up because I know I think differently. And he says, that's why I'm calling you. And so today, to have this blueprint be released to the nation, and we've heard some overwhelming responses from people who wear the headset. Just how exciting when we released the initial draft and recommendations, how inspired they were considering leaving the industry. They felt heard, change is coming, it's gonna get better. We understand that 250 million calls come into 911 every year. In New Orleans, a little bit about why we are so unique, most jurisdictions take 1 911 call for every 2 residents. So we should be taking about 200,000 calls. Last year alone, my agency took over 650,000 911 calls, total call volume 1.2 million, right? And so the people that answer that phone every day, they are relentless. They take their own problems and shoulder the city's issues every single day for 12 hours, and they do it with incredible vigor. And to be the leader of that organization and serve this city has been the greatest honor of my entire life. So thank you all. We all know that 911 has different infrastructures and set up weird around the nation, but the blueprint today will speak to the independence of 911, its own independent agency, having the ability to move with autonomy and advocate for resources and not subordinate to any other public safety agency. And we've learned time and time again I have to acknowledge one of my closest friends, Director Karima Holmes from the DC Office of Unified Communications. Thank you very much, Director Holmes, for being here with us today. People always say, I don't know how you do it in New Orleans. I don't know how you do it in DC. I got 1 police department to worry about. She got 27. So Director Holmes, again, thank you. And again, it's a great opportunity for us to celebrate today. And we're just so excited to be here. And I have the distinct honor, and make sure my notes are correct. Yes. We talked about sister mayors. One thing about New Orleans, our mayor loves to love on everybody, on our people, on each other, and also our elected officials in other cities. So I want to take an opportunity to welcome Mayor Regina Romero, who is the first Latino female mayor as well in the city of Tucson, to come up and give us some remarks. Mayor Romero.
Buenos dias. Good morning, everyone. I hope everyone's doing well. Thank you so much, Mayor Cantrell, for welcoming us to your beautiful city. It's a great time for me to be here with my sister mayor that I really appreciate so much, because you are leading on so many issues, and this is one of the issues that you're leading on. So muy buenos días. Muchas gracias por tenerme aquí. I have been also on the city council. I spent 12 years on the Tucson City Council and was elected in 2019. And in 2020, I'm sure Mayor Cantrell will agree with me, the world really changed because of the pandemic, but because also of the highlight that was put on policing and the systems that we have in place that frankly were not working. And we're not working for everyone, but we're not working for particular people, right? Communities of color, low-income communities. And they were not working for our own workers in the city of Tucson and throughout the United States. They were not working for police officers. They were not working for fire. They were not working for 911 communications. And so in 2020 is when I made it a point to change the infrastructure and the systems that were really causing much more headache and harm than good for our communities. And so 911 is a key point of changing how we police in our communities. And so you all play an incredible, incredible role. And since then, it has been a priority for me to make sure that we are really instituting the systems that we need to be able to do community policing and serve our residents well. I made it a point in my administration that is key: transforming 911, transforming policing, and how we deliver services to our community. So much so that I have, without hesitation, strongly encouraged Police Chief Chad Kasmar participation in these efforts since Transform 911 was launched, and as well as my entire public safety team, which I have the honor to have brought all of them to this conference. So it is my distinct pleasure to be able to introduce our Chief of Police, Chief Chad Kasmar, as well as, yes, he has been key in this particular effort, Fire Chief Chuck Ryan, Public Safety Communications Director Sharon McDonough, and a brand new position that we created to work along public safety, our Community Safety, Health, and Wellness Director, Sarah Lanias. We have been looking at these issues and collaborating with Dr. Rebecca Neustetter for a number of years now to better understand the 911 call system, to the demands for service, and what is best, how we can meet the community's needs. Mayors all across the US must support the effective functioning of the 911 system across America. Everyone knows the number, right? Everyone knows 911. But what we are facing is that we need to reintroduce 911 to our community. Here in New Orleans, you have 311. In Tucson, we're going to start in March, 311 systems. And we've heard before, right, that 911, a quarter of those calls are emergency calls for service. So we have to be able to create the infrastructure to be able to deal with the needs of the community: mental health, substance use, homelessness, and whatever other issues our 911 system receives. We've got to be able to provide that infrastructure and create new infrastructure and new systems. We need to make sure that we ensure the right response at the right time. As the mayor said, we have for decades been putting on the backs of police officers responsibilities and societal challenges that we haven't created new structures for. Police officers were psychologists, they were DV specialists, they have been psychiatrists. We have just laid responsibility after responsibility on the backs of police officers. And we expect them as people to know all of these things. So we are setting that system up to fail. And so we need to make sure that the systems that we're creating, along with reintroducing 911, adding 311 to our community, is creating the structures in order for a co-response model. And so people call 911 with every need in the book, everything. You're laughing because you know our 911 professionals understand that we need a much more diverse ecosystem to help them. And so that's why we need to make sure that we're putting people first in the center of all of the decision, and that these systems that we're creating, and even though we see New Orleans as a model, Tucson has a different system. We have different needs. Our community has different needs. For example, our 911 system, we need bilingual operators. And so every system around the country will need to be able to put their people and their community first. We need to make sure that we see the investments coming in. And thank goodness for American Rescue Plan dollars, we have been in the city of Tucson, just like in New Orleans, the mayor said, have been putting money in place so that we can change the infrastructure, because the infrastructure costs a lot of money to be able to provide a different system that works for people. We also need to make sure that all of you that are here, you're the professionals, you are the ones that know how to do this job. And so what we're doing today with Transform 911, we need to be able to go out and disseminate all of this information that we have in our fingertips now because of the wonderful work of Dr. Newstester and her team. So governance in terms of policy, for us in the city of Tucson and the mayor here in New Orleans, we play a role as elected officials because we have to change the governance in the policy. And that's what this team that we have up here has helped me do in Tucson, Arizona. So very happy to be with you here today. We are traveling together. We're holding hands as professionals in public safety and making sure that the systems that we create together actually work for our communities, and that they are people-centered, and that we have the systems in place in our communities where we can connect the people that need the services to the services that are available, whether they're created by your government or they're created by nonprofit organizations. So you're all going to help us go out to your communities, especially those in DC, and make sure that we're receiving the dollars that we need to continue bettering our systems, and that you all spread the message that it can be done differently. So it is my honor to introduce our police chief, Chad Kasmar, who has been working on these very issues for many years and will share additional details on several aspects of the Transform 911 recommendations, specifically as it relates to ensuring that 911 is independent and equal public safety partner in our communities. So with that, thank you so much. Muchísimas gracias, and Chief Kasmar.
Thank you, Madam Mayor. Good morning, everyone. Such an important topic and such an amazing group of people today to contribute to a conversation to capture the complexities of our 911 system. I can't thank Mayor Romero enough for her unequivocal leadership and focus on this issue in the city of Tucson and our public safety system, which includes your police department, your emergency communications center, your fire department, and your community safety, health, and wellness program that we have in Tucson. Your commitment to this issue, and so for eagerly supporting the Transform 911 process, is a model for other mayors to follow throughout and around our country. Well, as a chief of police in the city of Tucson, I deem all the recommendations contained within the Transform 911 7-point plan as essential. I'll be spending a few minutes talking about two of these in particular, as Mayor Romero noted: making 911 independent and making them an equal public safety partner. As a police chief of the 33rd largest city in the country, and as our previous interim director of our own City of Tucson 911 Center, I can speak to the importance of 911 centers being independent and equal to other public safety departments. I also want to emphasize, as you've heard from other leaders today, the need to support and classify 911 professionals as first responders. And let's give a round of applause. That is a really important topic. I call on my colleagues nationally who are serving as law enforcement executives and police chiefs to support and consider implementing this recommendation. Ultimately, we're calling for this for the following reasons. 911 centers, or as we refer to them, emergency communication centers, are independent and equal to other first responder systems that help improve outcomes in all of our communities. We are calling for local ECCs to be independent and an equal public safety department to public safety departments, equipped to tap a diverse range of responses to best match the response to each emergency in our community. This requires removing, as you've heard, the default police, fire, EMS, or other traditional emergency response that we've come to know with the deployment of our 911 system. The mission and function of ECCs across this nation have transformed from simple information transfer stations to critical points of the public safety life cycle. So thank you for your time today. I will now pass it to Washington State Representative Tina Orwall, who has been one of the most exceptional leaders nationally focused on the importance of the 911 professionals in larger emergency crisis response ecosystem.
Thank you, Chief Kasmar. And thank you all for joining us today. I'm Tina Orwall. I'm a state representative from Washington. I also serve as the Speaker Pro Tem. And this is such a high priority to me that when I got an invitation to be here, I did not hesitate to jump on a plane from the other side of the country. So very honored to be here. And you know, we've been doing a lot of work around 988. And part of what I started to do was visit our 911 call centers. I was so deeply moved by the dedication, the professionalism of the work being done. And as a social worker and mental health professional, I know there's a lot of secondary trauma of doing these positions. And so, you know, I was so surprised to learn that they were classified as administrative positions. And so I am so glad they reached out to my office so that I could be part of really making sure 911, as we move into these really complex times, is supported with the supports they deserve. So I think a part of what I'm going to talk about is, again, the workforce. And this is very small font. So I'm just going to wing it. It's not made for people over 50, some of these things. But again, you know, I introduced a House bill, House Bill 1703. And what House Bill 1703 did was begin to do that recognition of this as a profession. And again, we had really trying to make sure as we're moving into these enhanced systems that we're doing it and we're bringing the workforce along. This means training. This means adequate wages. And so I wanted to be here today to really challenge all the elected officials from all the states to really, hey, join us in really making sure we're recognizing this incredibly important. In fact, I can't imagine that your jobs have ever been more important than they are today. And so I really want to make sure as an elected official that we're doing everything we can to support you. And as we have the launch of 988 next month, right, this is going to be a partnership, right? This is a partnership of 911, 988, law enforcement, EMS. And so having our systems be robust, you know, having our systems staffed. I know a lot of our call centers are not at full capacity. And there's incredible turnover. And so we need to, and I think your report is incredible. And I did skim it last night. I look forward to reading it all because I think it's really, how we retain and train that workforce. It's going to be a really important next step. And again, I would say to all the elected officials out there, there's a template here of what you need to do to move forward in your state. And so I'm very honored to have jumped across the country to be here to really present on this. And so next up, I'm going to be introducing Portia Reddick White from the Vice President of the Policy and Legislative Affairs from the NAACP. Please help welcome her.
Good morning. Thank you so much for that warm introduction. And I bring greetings actually on behalf of our President, Derek Johnson, and our board chair, Mr. Leon Russell, who made it a chore in a way of his, a focus to make sure that we were here today, because our mission is to make sure that all community voices are heard, especially including the Black voice. From community to community, the Black community has experienced, as well as communities of color, so much, and we're under attack. We've expressed and felt this deep disruption with COVID-19, with police brutality, as well as voter suppression. So recently, along with President Derek Johnson, NAACP president, we met with Attorney General Merrick Garland to share our perspectives and to present to him that a shift is needed and a focus on public safety is needed and not criminality. As the mobility of people has increased, too has the need for making sure that we have a secure system to gain support for medical emergencies, accidents, fires, crimes in a way that support the community in our new ever-changing environment. The system that offers these things at this point, it needs help. We need to reinvigorate it and bring it up to par. So since 1967, callers have been able to gain assistance. The service has grown over the years, and too often, however, it's not equitable help. The help from state to state, county to county, city to city, and too often the Black community, the community of color, they fall prey to the 911 calls that end up putting community members at risk of life and limb instead of safe haven for help, health, and life. We need a system overhaul, and that's what Transform 911 is all about. So who are the brave ones that answer the calls of the so many? They are the first responders. The initial first responder to get the help that is so desperately needed. Without the men and women that serve in 911 as first responders, there'd be no firemen on the way. There'd be no ambulance on the way to intervene, no police to protect and support. And as a result, lives, of course, would be lost. People would suffer and property would be destroyed. I know I'm gonna sound a little cliche here, but I love the 4th of July. And so, well, actually, it's my birthday too. But on the eve of this great American holiday, celebrating the independence, the 4th of July, and as we sing these anthems, or the anthem about the home of the free and the brave, we owe those that hold the phone lines and support callers the utmost respect as they brave and they become, and they are, these first responders that they are. They're the ones that hear these devastating and desperate calls for help. They have to hold the hand through the phone of the women who are calling about the child that's hurt, the father who's crying out for help as his home is burning, the child who calls in the middle of danger seeking help and intervention for parents that are ill. May God help us for innocent bystanders as they witness the terror of gun violence as it unfolds, as they pick up the phone to dial 911. With all due respect, we owe these first responders so much. We owe them the dignity for the position that they hold, the support for the work that they do, including training to assist them to perform at their best, support for the anguish that they experience as they help others, and also to make sure that they're well compensated for doing so that they can sustain their lives and their families. We need a culture shift. one that adds the humanness of the system that exists to assist with the compassion of those that embrace it. If you've not heard anything that I've said, there are three things that I would love for you to remember. First, we need to involve the community as the 911 system continues to evolve in order to serve the communities in an equitable and supportive fashion. We have to educate the public while including them in devising ways to help the system so that it supports all the various needs of the community. And most importantly, with this point, the workforce must reflect the community that it serves. Number two, we have to embrace the 911 professional and properly classify them in their roles as first responders and give them the training, support, and compensation that they deserve as they support the community. This includes making sure that options of support are available when sending out help. Doesn't always mean the police. With this, there's obviously a need to overhaul our local government response agencies to make sure the right help is on the way. And we need to join together with a legislative approach to make sure this happens. And three, we have to be intentional about 911 service that's being provided. That includes not leaving everything to chance, putting national standards in place, collecting data, being transparent, and studying the metrics to better support the needs of society. Nothing should be happenstance. We should support the 911 system as we know it so that it can truly be the lifeline for help, unequivocally, for every community. And with that, I am going to introduce Budge Currier, who is the National Association of State 911 Administrators. Thank you so much.
Well, good morning, everyone. I am Budge Currier. I'm with the National Association of State 911 Administrators. So most of you in this room have probably never heard of us. So what we are, each state has a 911 administrator, and states vary, obviously, in the role that that person plays, but we help coordinate the 911 activities within the state. I'm from the state of California, and the role we play in California is dramatically different than some of the other states around the nation. But primarily what we're focused on is making sure that we're the liaison between the legislative activities, the funding that's provided for 911, and the needs down at the local level of those public safety answering points, those 911 professionals that are answering those calls. And that's what we do in each and every state. We meet multiple times throughout the year. One of the amazing outcomes of the pandemic was we started monthly. They started out on Zoom, now we're on Teams meetings where we have learning sessions where we share and commiserate often the challenges that we're facing in each of our states. And so I'm here today to support this Transform 911 plan. We met early on with the team. They brought their recommendations to us, and we had some tough questions for them. If you've read through any of the recommendations and participated in the project, there will be something in this plan that will challenge you. Something in there that will probably strike you a certain way and hopefully make that a reality that you want to turn that into an action. And that's really what we're focused on today. This blueprint that was presented today, and it's up on the website, it is collaborative, it's thoughtful, it's well researched. Just so being a former college professor and a researcher myself and an engineer, there's a ton of amazing data that this team has put together that is well researched and collaborative and represents really the interaction of so many thoughtful, well-intentioned, and purposeful people to develop this report that you see. And so we absolutely support the work that's been going on. It's encouraging to see such a diverse group of people come together that represent different backgrounds, different identities, different governance structures, different size 911 centers. In California, we have 438 public safety answering points. We answer 27 million 911 calls a year. We have everything from a 2-position center that's staffed with 1 person part of the time, all the way to second largest 911 center in the nation in LA. And so in my role in California, we have to find a way at the state level to put policies, plans, procedures, and technology in place that satisfies all of them. Quite challenging, I can assure you. On this effort, I really want to thank Daryl Branson from Colorado. He was our representative that participated in these meetings and really brought back to us at the board level the work that was being done. And we've tried to interact with those, I guess, naysayers when they read the report to help them understand what's really in there, what's the goal, what's the vision, and where we're headed. And we're really excited about this process. As the team met with us, they listened to our feedback, they've made updates to the document, and we're excited about moving forward. So in my role as the president of NASNA, I look forward to ways to implementing these 7 recommendations. We don't want this to just be a plan or a blueprint that sits on a shelf. We want to give feet to it. We want to find ways to implement it. And we want to work with all of the states to find ways that they can take the pieces of this blueprint and make them a reality step by step in each state across this great nation. So as we reintroduce 911 and ensure that we are partnering with the community, and we're recognizing that the workforce needs to be supported and trained so that 911 is independent and equal, and that those that provide this critical life-saving service send the right response at the right time using the best policies, technology, and training that's available that has support from state, local, and federal authorities. That's really what we're aiming at. And I'm so excited that we have the opportunity to participate in this process. And I think at this point, we're going to turn it over to questions. But I want to thank the work that you've done. This kind of effort doesn't happen without leadership and courage and drive and intelligence. And you have all of that. So thank you so much for the work you've done.
Well, thank you so much to our amazing speakers. You all have really presented an important aspect of this learning together, and we will turn it over to Q&A. Many thanks to George Rice, who's going to help us in that process.
Thank you, Rebecca. We do have a question that we received in advance. What can people do to support Transform 911 moving forward to help improve emergency response across the country?
Absolutely. What a great question. I'm happy to take that one. Immediately go onto transform911.org, view and download the blueprint, take it to your legislators' offices, make sure that they understand the contents of it. And first and foremost, if you don't understand how 911 operates in your community, learn now. And you can do that. We'll have a colleague in a few minutes actually sharing with us a way in which you can learn about your 911 center in your own community. But we want to make sure that people understand and become involved in the changes that they need to seek locally at the state level. Work with your state representatives, your state NASNA representative, as well as federal officials. And please feel free to reach out to us if you have any ideas or you want to join the movement at Transform911 at UChicago.edu.
We have another question that's actually quite insightful. Why was the 911 system originally set up like this?
That's a great question. I wonder, Budge, if you want to answer that.
So originally, when 911 was set up, we just had landlines. So those of you in the room that are born when cell phones existed, that was not me. Matter of fact, worked not far down the road from here in the Marine Corps, and I had a pager at the time. That's as advanced as we were. So when the 911 system was first made, it was landline. So when you called, it was from your home. We knew where you were. And the reason why you called 911, obviously our world is much more complex and challenging in today's world than it was in 1968 when that first 911 call was made. Over time, the system has grown, and we've taken and been able to provide location information like your address. And then cell phones came along where location moves all around. So they took that same basic system and they bolted on more technology that leveraged what was there to provide basic information on where that mobile caller was. And it really wasn't until mid 1990s that we started to really think about what technology innovations need to be made in order to facilitate the different ways that people communicate. Text to 911, the fact that we're a mobile society and 85% of the calls come from wireless devices. So over time, the 911 system has sort of incrementally grown. We're now taking time to stop, pause, and say, okay, let's look at the entire ecosystem. What's needed from a technology perspective, a training perspective? How do we equip those 911 first responders with the best technology, the best training, the best resources to match the need with the request? And so we're at that point now. Some states are farther ahead in that process. Some PSAPs or ECCs or emergency communication centers are farther ahead than others, but we're all on this journey together trying to figure that out. So it's grown incrementally over time is the short answer, and now it's time to get it right, and we've got a great opportunity ahead of us.
And thank you for that response, Budge. It's really great education. Also, just to highlight some of the remarks that Mayor Romero and others made is that, you know, the 911 system initially relied just on fire, police, and EMS. And we really want to see that ecosystem grow, that we need a much more diverse set of responses in our communities today. Are there any other questions, George?
Sure, we have one that follows on some of the comments that came out throughout the press conference today. What role does 911 play in advancing public health and community safety?
Mayor Romero, would you like to answer that question?
Absolutely. 911, as we have been saying, they are the receivers. They're the first response, right? They receive those calls and they have to assess what the needs are. With the appropriate training, they can divert those calls to whatever the situation is happening. In Tucson, Arizona, unfortunately, we had an in-custody death. And it was excited delirium, I believe. It was a person that was going through, Carlos Adrian Ingram Lopez is his name, or was his name. And he was going through an attack, a panic attack, based on drug use. And so if it would have been a co-response model or a different, other than police response, then it could have been a different result in that situation. And so I think that being able to have the psychologists appropriately train people to respond to the situation that is happening. That is the ultimate goal of being able to have 911 connect to the appropriate response. That is the goal. And so it's doable. We just need to be able to, and Transform 911 is the beginning, I think, of what we're trying to do in Tucson, Arizona, which is to be able to attach, besides fire, police, EMS, we need others to be able to respond to different situations in our cities.
And George, do we have time for one more question?
I believe we may indeed. We have a question from Matthew from the Columbus Division of Fire. Is there an effort to change the standards that 911 centers are graded on?
Absolutely. Yes.
So yes, there's certainly an effort, and in each state, it's going to look a little different. Some states are what are called home rule, where basically local rules are what they really want. So in those states, it's more like a recommendation that can come out or a best practice from the state level. In states like California, where we have more statutory authority, we may be able to go one step farther and actually put requirements in place that says these are minimum standards. But if you read through the blueprint, really the goal at the federal level should be to establish just sort of a baseline that everybody can agree upon. And then locally, because the needs are so diverse and so different, and each state has a different authority in what they do, I think it's important to realize that while that baseline will be important, each state will then have to refine that down, and then eventually it goes down to that local public safety answering point that's providing those 911 services. really, that's where the rubber's going to meet the road. And I think one of the things we're doing in California is we're trying to ask the question, how can we help at the state level? And how many of you have received a helping system from the state that wasn't so helpful? And so we're asking these questions now. How can we help with things like training and recruitment and retention, and to ensure that the right tools and skill sets are available down at the local level? And so all of that is addressed in the blueprint, and I think it's an important part of this entire process.
Well, thank you so much. Please join me again in thanking our wonderful speakers. And I just want to close with, Transform 911 was a diverse set of stakeholders that came in order to develop consensus around a core set of recommendations. The speakers before you today also come from a very diverse set of perspectives, but we have a unified perspective here that we need to transform 911. And some really actionable ways in which we can do that, starting first with supporting our 911 professionals. So please join us today in figuring out how you personally can support a 911 professional in your community. And please continue to join us throughout the day as we explore more of these conversations together. Thank you again. The hardest part of the day, keeping on schedule for this press conference, we completed it. Yay!